guys! Today we're going to talk about general ethics in the medical world, and basically all of our notes today have come from BMA, it just explains, what we're going to tell you is going to help you to explain what you should do in any ethical scenario. And we're filming today because next week we have medical school interviews and we're not going to have time because we need to do lots of preparation. So we're going to start off with, because a lot of ethical scenarios, they say do what's in the best interest of the patient, but we want to tell you what that actually means. So do you want to?
Yeah, so these are the factors taken into consideration when thinking about what is actually in the patient's best interest. So the patient's own wishes and values, including any advanced decision, clinical judgment about the effectiveness of the proposed treatment, particularly in relation to other options as well. And when there is more than one option, which option is less restrictive of the patient's future choices. Also, the likelihood and extent of any degree of improvement in the patient's condition if treatment is provided. The view of the parents, if the patient is a child, need to be taken into account because children are often not competent. The views of people close to the patient, especially close relatives, partners, carers, welfare attorneys, court-appointed deputies or guardians, and any knowledge of the patient's religious, cultural and other non-medical views that might have an impact on their wishes.
And for the first point, when we said advanced decision, that's basically a living will. So if a patient is aware that maybe in the future they're going to lose capacity, so maybe they might have, dementia or something like that, they can basically write what they want to happen to them, and it has to be respected, really. Okay, so first we're going to talk about children and young people. So basically, if you're under the age of 16, you have to be proven to be competent to have a treatment, really. And these are called the Gillick principles, or the Fraser principles. And it basically, that is how you decide if a child under the age of 16 is competent enough to make their own decisions. So this is what you have to take into consideration.
So the child needs the ability to understand that there's a choice and that the choices have consequences. They need the ability to weigh the information and arrive at a decision. And they need a willingness to make a choice. And they also need to understand the nature and the purpose of the proposed intervention or treatment. They need to understand the risks and the side effects. And they need to understand the alternatives to that treatment and the risks attached to them as well. And they need freedom from undue pressure, so they can't be pressured by relatives or anyone else when making a decision.
And the people that are making this decision must be skilled and experienced in interviewing young people, so they know how to judge if they're competent or not. And so the treating doctor may be the most appropriate person, or even any other people that have a close rapport with the patient. So even a GP, because GPs tend to see patients from to the second they're born to when they die, so they could be a good person in assessing competence. So we're just going to go on to say other factors you can consider when making ethical decisions involving children. So parental responsibility. So maybe when the child isn't deemed competent, parents must make the decision. So parental responsibility automatically from birth goes to the mother, but the father also has parental responsibility if they're married, or if they're mentioned on the birth certificate. So but if the parents are separated and not communicating, but they both have parental responsibility, the GP or whoever is providing treatment is advised to tell the other parent, or advised to encourage the parents to communicate so they both know what's happening to their child. So if a competent young person refuses their treatment, that could be life-saving, or maybe will prevent them from falling into further injury. You can basically override what they've said. It could sound unfair, but they're trying to do what's in the best interest for them. So it can be, firstly, the doctor will try to discover why they wouldn't want this treatment. And then they try to get parental responsibility. So through parental responsibility, they try to get consent from the parent, or they may even go to court, and both of these can override the child's choice. But even when they have consent from either the court or the parents, it doesn't mean that it could go ahead, because they'd try to go back to the child and see if maybe further time discussing it with them, or doing things like that will try and change their mind before they do something that maybe the child doesn't want, because that could break the doctor and patient trust, and the child could have, maybe for the future, maybe not want to go to the doctor because they think they're going to do things that they don't want to them. Do you want to do these ones?
Yeah, so parental refusal of a treatment isn't accepted if the treatment is considered to be in the patient's best interest, and the competent young person and has to consent to the treatment, and the court has to approve of it. So if there's disagreement about what's actually in the child's best interest, only emergency treatment should be provided. And in the meantime, further discussion should take place, and a second opinion should be offered, and this could need legal advice.
So court can overtake a parental responsibility and a child's refusal if worse comes to worse, and even the parents are rejecting the need for life-saving treatment. However, when it comes to problems like abortion, sexually transmitted diseases, and contraception, things change a bit. So do you want to do this?
Yes, so parents can't override a competent child's decision on treatments for STIs, abortion, or contraception. So a doctor must consider if a patient's going to have sex without contraception before providing the treatment, and if their mental health will be damaged in any way if they don't receive the supplies. And if the child is under 13 and having sexual activity, then that's a cause for concern, and it could put them in danger, so the doctor should share the information with police or social services. They also need to take emergency action if the child is deemed to be in danger, and they need to keep clear and accurate notes, and they shouldn't be discharged from a hospital without being registered with a GP in order to ensure that the child's safe. Also, if one parent consents and the other refuses, one consent is sufficient.
And for if even though 16 is the age for you can have sex at 16, but if a child comes in under 16, between not 13, like 14 or 15, and asks for contraception, the doctor must respect that they've come to the doctor and keep it confidential, so they don't actually need to tell the parents. They would just try to encourage the patient to tell their parents, but they just need to respect that they can make that decision for themselves. Is there anything else written here? Don't want the parents. Okay, I think we've covered everything here.
So we're going to move on to gifts. So if a patient wants to give a doctor a gift for their gratitude, doctors can't actually accept gifts that could affect or be seen to affect the way in which they treat their patients or advise them. So this could cause bias, for example. And gifts of cash and vouchers should always be declined. And gifts over the value of £50 should be treated with caution, and they should only be accepted on behalf of an organisation, and if they are accepted, they have to be declared.
Okay, so now we're going to move on to consent. So before any type of treatment, you always need to get consent from the patient, and before the patient can give consent, they have to know all the details. So that includes the purpose of the investigation or treatment, details of and uncertainties of the diagnosis, so if there's a risk of it going wrong, options for treatment, including the option not to treat, the explanation of the likely benefits and probabilities of success for each option, so risk and possible known side effects, complication and adverse outcomes, the name of the doctor that will have overall responsibility and that the patient can go to if they have any concerns, and the reminder that patient can change their mind at any time, because if you're over 18 and you reject treatment, even if it's life-saving, the doctor must respect their wishes. So it's different to if you're under the age of 16. So yeah. And then,
So, because of patient autonomy, a doctor can never make the decision for the patient, even if you're asked to as a doctor. So, a doctor also needs to make sure the patient isn't under any pressure from anyone else receiving treatment. And in an emergency situation where consent can't be given, the multidisciplinary team must provide treatment that's in the patient's best interest, so that's when they would decide themselves. However, if it's known that they would refuse a particular treatment, such as a Jehovah's Witness refusing blood, then the treatment shouldn't be given. And if the treatment requires the patient to be unconscious, the doctor has to receive consent for fixing any issues that may arise during the treatment. And patients who are normally competent may be momentarily incompetent, for example, if they're unconscious, to give consent, or if they're drunk, in shock or scared, or they have severe pain or are fatigued. And mentally ill patients could still be competent. People over the age of 18 that have competence can appoint a welfare attorney to make healthcare decisions for them. Once their capacity to make decisions are lost. So when no welfare attorney has been appointed, the doctor must treat without consent while in their patient's best interest.
okay, so situations as a medical student, is that, I think, yeah, so we're done with that. So these are just random situations that you could be thrown at you in like interviews. So if you're asked to perform a procedure as a medical student, and you're not sure what to do because you're not like a doctor yet. So if you're correctly supervised, so you have maybe a doctor that can do the procedure and has given you permission to do it, and if you've had appropriate experience in it, so you have been trained to do it in your course, then you are allowed to do it. Otherwise, you should say no, because you have to do it in best interest of the patient, and doing a procedure you're not comfortable with can lead to them getting harmed. Another one. Do you want to do that one?
So getting consent from patients when you want to write about them in medical school reports is very important. So you have to get consent, and even then you have to make sure that they're non-identifiable in your writing, so don't include any personal details about them. And if you're concerned that a doctor or another healthcare professional is intoxicated, medical students need to report it to medical school and see what they advise you to do.
Okay, so sitting in consultations that don't respect your personal beliefs. So maybe people or medical students of different religions that maybe don't agree with IVF for maybe gay patients, or abortions, or different ethical things like that. If they don't agree with it and they're asked to sit in a consultation where the doctor might be talking to a patient that's asking for these things, they should always sit in the consultations and ignore their personal beliefs, because it's important for them to learn about when faced with these decisions. And even when you are a doctor, if you don't wish to perform a treatment or a surgery that you're not comfortable with, you have to give a reason, but always tell the patient that they can get a second opinion. But as a medical student, you still have to sit in the consultation.
So medical students with a criminal conviction should always declare it to their medical school and to the GMC when applying for a licence to practice.
And if you suspect a fellow medical student is having specific issues, so maybe they're drinking alcohol all the time or just seem to be generally upset, you should always talk to the student first to see if it's anything you can sort out. Or if it's something more extreme, you should always report it to the medical school, as the medical school will be able to offer further support. And that's all we've written.
Thank you for watching.
Bye.